and again, I don't know. I just got to say, again, the governor had this press conference Friday. I know you guys were all there. We had a huge turnout on the viewers to watch it all the way live.
Albeit there was some audio problems at the beginning.
There were
that was not our problem.
No, yeah.
That was just Adloop's problem with the audio.
Right. But the problem was this. I mean, can you imagine this morning? It's Monday, and we're trying to unpack this thing, and we're having the hardest time. Well, take yourself back to Friday's press conference, where obviously the media, we still have a million questions to ask, but for some reason, the governor and her availability, to me, they got to work on that. You can't come out here, and it happens all the time. It's like as soon as people start really asking questions, all of a sudden the governor has to go to an engagement. I mean, Friday, I'm sorry, there was nothing, absolutely nothing more important than sitting in that press conference and answering questions for the people. That was it. There's no engagement. No proc signing, ribbon cutting, whatever photo opportunity that was more important than sitting your ass down in that chair and answering these concerns from these people, whether it's you or your doctors or whatever panel of high command, whatever. I mean, there's really nothing more important than that. What engagement could be more important than that? So anyway, I did try and ask the question about the businesses and what kind of heads up they had gotten at the press conference.
This was also a question from Maureen Martita.
Right. Is aware of this. Hotel Restaurant Association is aware of this. We've been communicating with them, and businesses are. This is not we're just laying it on the businesses today. There's been discussions with the businesses. Art has been meeting with Mary Rhodes from the Guam Hotel Restaurant Association. She's given him some ideas and input about the protocol and the guidelines. So this is a very urgent matter, and it needs to be effective immediately.
I'm speaking with key hotel and restaurant leaders, and they say that they weren't informed that you were going to implement this today, and they were under the impression that they were going to be given a month. I'm looking at a chat with one now, and they say it is impossible for any business to implement this at this time. You know, this being considered, Governor, you don't think it's a little harsh? Like, you don't want to say, let the unvaccinated people dine outdoors or something?
I don't want to argue of, he said, she said. I know for a fact that the director and even Chima met with Mary Rhodes, who's the head of the Guam Hotel Restaurant and Association. And so we are relying on her authority and her responsibility. The other thing is, the bottom line here, Chris, is we are seeing a rise in our cases. We are seeing a rise in hospital admissions. We are very concerned about the fragility of our healthcare delivery system to be able to provide the necessary services for those that are not COVID-related diseases. We are concerned about that. And I think as responsible leaders and as governor in charge of keeping our people safe, this is the action that I am taking.
And I wasn't trying to argue with her. I was just asking a question. Mary, good morning, Mary.
Have a day. Good morning.
Good morning.
Can you kind of just set the record straight there? Because it wasn't really a case of he said, she said. What was actually said by you?
Yeah, GHRA issued a statement immediately after the press conference because the information that was shared in the executive order did not match the conversation that we had with public health the day before. And I have to say, we spent a little over 2 hours. I spent a little over 2 hours with public health. I've had meetings with my board members the last couple of weeks. We've talked about all of the options that the Physicians Advisory Group were recommending and really what the operational issues and concerns would be. And I think that, with your earlier guests, all of those individuals were in that room with me, being Chima, Art, Tom, And, GHRA really works a lot with public health, and we have a really great relationship. And I thought we had a really good meeting based on all the recommendations, all the scenarios, and how difficult these things would be to implement. And I think it's extremely important that we, as a community, as leaders, when you implement these kinds of mandates or restrictions, you need to know how it's going to impact the community as a whole. But more importantly, we've continued to work together to get to herd immunity. We knew at some point that we will continue to see positive cases. And our whole point of vaccinations is to lower hospitalizations. And so the recommendations that were considered, or at least what I thought was considered as options, some of them were actually the guidelines in how we were operating prior to the lifting of COVID restrictions in July. So if businesses had an option of whether or not they wanted to check for proof of mandated vaccines, or proof of vaccines, then they could, if they don't want to do that, they could operate at 50% occupancy without having to require that, and still have no more than 25 for social gathering. And so that's everything we had discussed. If you want to operate at more than 25 for social gathering, or you're willing to check for proof of vaccination, then you can operate at 100%. It's actually a lot more reasonable. It gives everybody some flexibility. It allows everybody to still make educated decisions on how they're going to interact in the community, still practice safe and health protocols. And the more important thing is we're balancing the safe and healthy health of our community together with our economy, because we've done everything that we're supposed to do in this last year. And GHRA has led the effort of rapid testing, vaccinations at the workplace. We have led a lot of initiatives together with public health, with the Physicians Advisory Group, with GRMC and AMC. We've done a lot of the vaccine clinics, but we don't mandate vaccines at the workplace. We've never been for that. We've always said it's up to the employers, because there are a lot of exemptions there are a couple of exemptions with religious medical reasons. And it's really about educating the community, doing these outreaches, and trying to get more people engaged to keep them safe. We cannot afford more lockdowns. We know that things are rising, but the numbers prior to lifting of restrictions on July 21 were really a lot more palatable. And even the Delta variant was already here. And so the question is, why are we continuing to see increases, right? So you lower back gatherings as recommended to 25 until public health can actually even catch up with all of the contact tracing. There's a lot of things that goes into the mix, and it's not just about how the public accesses services. And we cannot limit accessing services or restrict it. We can only put some guidances on how they should access services, including dining and going out to other establishments. But it should be consistent. It should be consistent with public as well as private sector. It should be consistent across all industries. And so GHRA was really for the options, and we really wanted them to strongly consider the options of what the Physicians Advisory Group was recommending.
So have you had any conversations with public health or the governor since that press conference?
Yes, I've been talking to different individuals from public health as well as the governor over the weekend, and really going back and forth on this. And I don't think that's what we should be doing, is really going back and forth on, just how it happened and how it didn't really result.
No, I mean about
in a
going
good
forward.
thing. Yeah, going forward. So we do have a meeting with the governor, with public health as well as the Physicians Advisory Group. And I think it's important to really convey that we are still looking at the options. I still think that businesses and the community, and think about our different communities. We have local residents, we have military residents, military transfers here on TDY, as well as tourists, right? And we're trying to grow that. So you have to balance all priorities. And And I think that you had some really good questions earlier about how public health is going to operationalize this and enforce it. It's extremely difficult and it's extremely challenging. So can you only imagine what the businesses are feeling or what the guests or patrons are feeling? And this is at a time where PUA will be ending first week in September, when minimum wage is increasing and we're supposed to add more. So we strongly recommended to add systems as well to help with the enforcement portion. And I know one of the things that Chima mentioned was the exemption. So I asked, public health, what does that exemption look like? Because I've never seen one, and how do we convey this to our businesses? So I did text Chima. He said he'll give me a copy, but I'd like to know what the process is, because that's a lot of people who are going to be requesting for this. And if their response time is 5 days, similar to contact tracing, how long does it take for everything? There's going to be a cumulative effect on all of this. And so that's why the timeline to implement this, I know the enforcement is pushed to September 6th, but we were expecting actually end of September. We thought that they were going to allow businesses to even do the options by the end of September. And we never discussed mandating vaccines at the workplace. We never discussed that.
Do you believe
we believe in educating and providing resources and doing outreach to increase vaccinations, but we've never been for mandating vaccines at the workplace.
Do you believe the governor has the authority to mandate private businesses to vaccinate their employees?
Now, the governor has the authority under emergency, right? But just because you have the authority doesn't mean you should use it on every issue,
well,
every instance.
I don't think you know our governor very well, because she got the authority. It's getting used a lot.
So
yeah, but that's why you get the advice of the industry stakeholders, you get the advice of the physicians, and you come up with reasonable guidelines with what can be implemented, but also can be enforceable. And so that's how we want to move forward, is finding things that we can actually agree upon that we know is reasonable to expect and can be enforceable, and allowing people the time to implement these changes, and the community to also go out and get their vaccines if they want to, participate in the options that require vaccinations, right? Like if you're going to attend a gala, or if you're going to have a larger funeral, or if you're going to have a larger congregation, you have to have all of them vaccinated. So the number that we were looking at is you don't have to have mandated vaccines for checking for proof of vaccines for under 25. Anything over 25, you have to ensure everybody's fully vaccinated.
So you believe that the governor does have the legal authority to implement a mandate like this on the private sector?
No, I think it should still be up to every employer. That's why GHRA has never really pushed for mandates. I think that the oversight that she has with the government agencies, the line agencies, right? She obviously does that. She's not doing it with autonomous agencies. Those autonomous agencies have to go through their process of getting those approved. And so the same should be given to the private companies. Just because California and New York and all of those other places have implemented that, their herd immunity is not where Guam is at.
Yeah, that's
and
so
so
key,
it's really,
Mary. That's so key. That's so key, because I know that I think it was Joseph Cameron came on this morning. He said, "Hey, they're doing the same thing in New York. They're doing it in Hawaii. They're doing it in California. Yeah, but their vaccination rate, I want to say, is like 50% or something. It's not what ours is."
You can't compare us to other markets. We can look at other markets to see the best practices of what they're doing, but it doesn't mean it makes sense for Guam, because our numbers are better. Our numbers are actually way over 80%, and they're continue to be added. And so you can't apply the same things to each market. You have to consider what the island is going through, and also what we're planning to do. I mean, with the whole thing with Airbnb, you heard it already. I mentioned to Breathe over the weekend that it's already been in our protocols, that until they're fully inoculated, fully vaccinated, they can't dine in anyway. So Airbnb was already thoughtful in that process when I wrote the guidelines to know that we should not be bringing in visitors and having them dine in until their vaccine is fully in effect. So they do have restrictions. And that's how we should look at everything, is when we're putting these guidelines, is how reasonable is this, enforceable, and then how do we implement, knowing that we still have to move forward.
You know, I think I also, when we were discussing this whole executive order over the weekend, and we just heard it from Dr. Nguyen himself, that wasn't the recommendation. Chima, I'm not sure what he was saying, other than it's a privilege, right? For
it is a privilege to advise this governor.
Right, so I'm just kind of wondering, do you know who then is advising the governor, especially with regard to this mandatory vaccination of private sector?
I do know, I've spoken to a couple of the employer non-NGOs for private sector, the non-government organizations, and I know that some of them, they weren't included in this conversation. There is an economic advisory task force group, right? And there's an economic recovery group. There's a lot of different advisory groups. In the case of GHRA, we belong to the working group for the economic advisory group, and we do belong to the economic recovery group at GDB. But none of the conversations on these guidelines or this executive order went through any of those routes. I do know that I was called by public health because, again, our relationship with public health, and also the governor wanted to make sure, because I had been working with the Gov over the last couple of weeks to make sure, you know, mask mandates were being enforced, and especially while the military were here. I mean, we're always working together to ensure people are in compliance. And that is our role with the government, is we advocate on the businesses, but we also work towards compliance. And so we do have those working relationships, but I believe that they only reached out to GHRA for input, and our input was in line with the PAG's recommendation.
Mm-hmm. Have you heard from any of your members or what have been their concerns? Because I know we already have one.
A lot of them are extremely concerned about their employees in meeting this mandate. There's just not enough time to get people vaccinated, but also there are people who can't get vaccinated. And then there are businesses who don't also believe in the mandate. There are some who do believe in it, but you know, that's why you give businesses options. It really should be up to each management, owner, representative for how businesses comply with this. And it's also an issue with regards to the guidelines, with all the restrictions on 100% mandating vaccine. What we had put in was to give those businesses options of how, because they know who their guests are. They've seen the contact list as well, and they maintain those. And so all of those other protocols, as you heard from public health earlier today, even with the restrictions in place, they're still expecting the basics. So why can't we just consider the options that we talked about and still have the basics? What is the difference?
Mm-hmm. Yeah, and
we're also not removing health and safety protocols.
Mm-hmm. How does this work for business for people that have scheduled weddings and things like that, and in some of the ballrooms and?
Yeah, it's very challenging. You know, nobody really operates in this kind of environment, but we are in a pandemic and it is very challenging. I can tell you a lot of businesses, it's a day-to-day occurrence, right, of how many people have different situations or different things that they're worried about. But really, first and foremost, it's not just the planning of events, it's also employment right now. I mean, that is a huge concern. And then the whole thing about they don't even have in there whether or not you can do testing. Well, who pays for the testing if this is a government mandate? Does the government pay for the testing?
Yeah. And
do the employers do it?
And if they're
Does the individual? Do you know how much a PCR test costs?
Right.
Yeah,
that's not covered by insurance. It's $150 to $200
But Mary,
per test.
Mary, they can go line up at Tizen for 5 hours to get tested.
Yeah, but see, that's where Dr. Nguyen was recommending, I believe, in the media today, is they need to look at also how they're testing. they need to triage people first and use either the Abbott machine or which is molecular, or do the antigen blood work, which only takes 15 minutes. Why are we not using that to screen out people who are truly positive and then do the PCR test? Because the lines are long, the wait is long, and also there's delays, right, in notification. And so it's really about how do you cut back the time that's being exhausted, and how do you improve efficiencies to notify people if they're positive? So then also contact tracing takes place immediately after that to start notifying others. And so I think we have to go back to the basics of are there increased transmissions and where are they coming from? Yeah. Already public health and the PAG, they have already said it didn't come from restaurants. None of the transmissions came from restaurants as clusters. And so maybe there's one or two, but none of the clusters and none of the large transmissions came from restaurants. Yeah. So why are we always being identified as having the most strict?
Yeah.
It's because restaurants, bars, and bars are in the same guidelines. And so that's the challenge there. It's restaurants, bars, and taverns are all in the same guidelines.
Right.
And so that's why we kind of get muddied together, right? And some people are operating as restaurants and bars.
Correct.
And so it's just very challenging. I think it's better to reconsider the options, amend the executive order to allow more time for businesses to acclimate to this, as well as individuals if they want to get vaccinated. And then also to consider the options so businesses will choose how they will protect the community, because everybody has a responsibility, individuals, the businesses, and the government.
Yeah, I mean, we heard this morning from Chima that there's another cluster that's stemming from bars. And I wonder, with so much of the concern really before the press conference focusing on the positive cases with kids in school and the spread clusters through social gatherings and bars, and this EO, I feel, doesn't address that. She could have laser focused in on the bars and been like, okay, whatever, occupancy down, this, and this, social gatherings, unvaccinated, vaccinated, if you have 3 eyeballs, I don't care, we're going to limit it to 25. Obviously, if you want to put out a fire, you throw a rug on top of it. I'm just not, to me, this is more like throwing something with a lot of holes in it, because it just
and we have to consider not everyone can operate in the same way, right? We have small and large businesses. In a large business, you can put other employees who are not vaccinated in other areas so that they're not in direct contact with customers. In a restaurant or these other establishments where they're listed on this EO and guidance, they don't have other options. And so that's very challenging. So we have to really think about the community as a whole and how we're going to balance the health and safety of our community together with the health of our economy.
Thank you, Mary.
Thank you, guys.
Thanks, Mary.
Good luck. Good luck in that meeting.
Okay.
Wow, you get to go
All right,
go meet with the governor after all this. Woo, boy.
Yeah, like I said, we've continued to talk through it, and I'm really hoping that we can find a way forward, because I know that there are a lot of concerns and some people who are supportive of this, right? Yeah. But it's really about making what's beneficial to all.
Right. Mm-hmm. Thank you, Mary.
Thank you.
Okay,
Thank you.
We're going to keep it going as we're really getting in danger of running over here, but we wanted to bring on Tara and Len from Hafaloha, as they had come out with a release. I think it was on their social media yesterday. Yeah. Bree, if you could, and then we'll get right to that. This is the link, by the way. We're proudly brought to you by Pacific Points, Cabo Enterprises, ITNE, and Jack in the Box. Miss a link, miss a lot. Guys, we had public health on, Dr. Hoa, earlier in the show, so when the broadcast gets put up, you can go back and check